Hey, and welcome to the Chesapeake Food Shed Network's virtual food system webinar series. I am Kristen Markley with Healthcare Without Harm. I'm also a member of the Chesapeake Food Shed Network steering team, and I co-chair the Chesapeake Farm to Institution Work Group, which is a partnership of Healthcare Without Harm and the Chesapeake Food Shed Network. Today and tomorrow's webinar is a collaboration between the Chesapeake Farm to Institution Work Group and the Metropolitan Washington Council of Governments Local Food Distribution Work Group. I'm pleased to welcome over 190 registrants for these webinars from across the country, as well as our resource experts that are on the webinar today, who I will introduce shortly. So welcome, everyone. Next slide. The mission of the Chesapeake Food Shed Network is to catalyze connections and collaborations for a sustainable, resilient, inclusive, and equitable regional food system in the Chesapeake Bay watershed. If you participate in or support the extraordinary work happening across the region, as well as the mission, please consider participating in the Chesapeake Food Shed Network. In fact, anyone who supports the vision is invited to participate, and the website will be listed at the end of the webinar. The CFN food system webinars provide a platform to catalyze connections around specific food system topics. The CFN partners with resource experts who provide a quick learning opportunity through the webinar for food system change agents across the Chesapeake Bay region and the country. To extend the learning, we identify ways for people to engage and dig in deeper following the program. Next slide. Participants of the Chesapeake Farm to Institution Work Group include hospital, school, and college food and nutrition services, population health professionals, agricultural professionals, food hubs, nonprofit organizations, extension educators, and others who are interested in learning about the common barriers, strategies for success, and cross-sector opportunities for institutions to collaborate and support a sustainable, resilient, inclusive, and equitable regional food system. For 2018, interactive webinars and in-person events are being planned to address the needs of the different stakeholders in these initiatives. At the end of today's webinar, we'll share several upcoming opportunities to get more involved in the Chesapeake Farm to Institution Work Group. Next slide. So one of the sponsors today is Healthcare Without Harm. I am Kristen Markley, the Mid-Atlantic Regional Coordinator for the Healthy Food and Healthcare Program of Healthcare Without Harm. And here is our website and my contact information. Next slide. And thank you to our other co-hosts, the Metropolitan Washington Council of Governments. During tomorrow's webinar, Lindsay Smith will tell you about the Local Food Distribution Work Group. Next slide. So again, today and tomorrow's food safety webinars were developed by the Chesapeake Farm to Institution Work Group, which is a collaboration of Healthcare Without Harm and the Chesapeake Food Shed Network, and the Metropolitan Washington Council of Governments Local Food Distribution Work Group. Our thanks to the Local Food Distribution Work Group for leading the initial conceptualization of these webinars based on feedback from members of both of our groups. Before I do introductions, I just want to go over a few housekeeping items. If you're not familiar with Zoom, you can take this opportunity to get to know this platform a little bit. You'll notice on the Zoom control panel below the slides, you should see chat and question and answer options. If you don't see these, hover your mouse over the bottom of the Zoom screen and they should pop up. You're invited to open the chat box and type to all participants and attendees your name, affiliation, and where you're joining from. It'd be a great way for all of us to know who is on today's webinar and do some networking. During the webinar, we'll use that space to share prompts and information, so keep an eye on the chat box. And please post questions for presenters into the Q&A box at any time. I will collect questions and moderate a Q&A following all of the presentations. So let me just briefly go over some introductions for the resource experts we have on today's call. We have Amber Vallotton, who is the Fresh Produce Food Safety Team Coordinator and Extension Specialist for Virginia Cooperative Extension. Amber will talk about Virginia Cooperative Extension's Fresh Produce Food Safety Team's statewide market assessment survey in 2015-2016 of buyer expectations and perceptions across multiple market sectors in Virginia, which includes colleges and universities, direct-to-consumer markets, hospitals, public schools, restaurants, retailers, and regional wholesalers. Amber will also talk about food safety training and resources available to Virginia producers. Lindsay Gilmour will review GAP principles and describe requirements for GAP certification and the FSMA produce safety rule. FSMA stands for Food Safety Modernization Act. She'll talk about the differences between GAP and FSMA and when a farmer must comply with one or both. And Dr. Rohan Tikekar, who is the assistant professor at the College of Agriculture and Natural Resources in the Department of Nutrition and Food Science at University of Maryland, will give an overview of the FSMA preventive controls for human food regulation and hazard analysis and critical control points, also called HACCP, and the differences and when a producer or processor may need to comply with one or both. And then we will have Becky Howe with Weaver's Orchard in Morgantown, Pennsylvania, and she is the food safety director for the orchard. Okay, and right before we get started with our presentations, starting with Amber, we're going to launch a poll, and we'll give you a minute to make your choice here. Okay, and Yona is operating the poll. So Yona, if you think we've given people enough time, if you can show the results.
Great, I just see people are we'll give people 3 extra seconds here to get their votes in and share the results back. Great, it looks like 42% are affiliated with a nonprofit, 25% are farmers and producers, 19% from food hubs or other local food distributors, and then 15% from government. So we've got a really nice spread throughout, and we'll share these poll results at the end.
Nice, that's great. Well, welcome everyone, and I'm going to turn it over now to Amber, our first presenter. Thank you, Amber.
Thank you. Well, it's wonderful to be here today. And as Kristen said, I'm going to share some about a market assessment that we did in Virginia and also share some about what we're doing in Virginia. So I thought I'd just start quickly by sharing what the Fresh Produce Food Safety Team is. We work across the state of Virginia with a wide array of stakeholders and producers and others in the area. We're a team of extension specialists and field agents, and as you can see from our map of Virginia, we have a wide spread there. We work in all the counties in Virginia, and just trying to help folks understand what it is they need to do in terms of food safety requirements. This really feeds into our larger food safety programming. I specifically work with produce safety, but obviously there's a lot of different food safety issues out there. And so as we think about the farm to table continuum, a big part of what we do is really this whole continuum from the farm to the fork and all the areas in between. Virginia Cooperative Extension is working with a lot of areas here, and the Fresh Produce Food Safety Team really tries to help producers navigate the playing field in terms of how they can get into new markets and all the different levels of training that they might need to take, as well as working with consumers and others in the industry to really help them. So what I wanted to do was really set the stage for today's discussion. In Virginia and of course in the broader Mid-Atlantic region, we know that there's been this growing demand and support for local foods, and that's a really wonderful thing. With that though has come a lot of different variety in terms of what the food safety expectations and different policies, requirements that are out there within the marketplace. And so this can present significant barriers to producers who are trying to tap into those markets, but also represents some challenges for the buyers in those marketplaces to be able to convey and communicate what their specific needs are to meet their market demand. This trend is particularly true if we think about institutional buyers like hospitals, colleges, and universities, just because they are often constrained by many institutional and corporate policies, liability, different things that kind of play into that larger marketplace. So how do we help producers trying to navigate these different food safety requirements? We recognize that a one-size-fits-all doesn't exist. If we think about a producer who's trying to get into these different marketplaces, there's so many different challenges and obstacles and barriers and things that they really need to know. And just trying to maneuver through that is a challenge. So what we did in 2015, we applied for a USDA specialty crop grant or a marketing grant where we looked at we really wanted to better align what was going on between the marketplace and helping producers know what they needed. So we conducted a market-wide assessment. We wanted to really get a good handle on what are the expectations and perceptions across multiple market sectors in Virginia. We looked at direct markets like farmers markets and CSAs, colleges and universities, hospital and healthcare systems, public school systems, restaurants, retailers, and then the wholesale market. We started with an online survey of questions which was focused on the principal buyers within those markets and asking questions such as what their purchasing roles were for their organization, what produce sources were used when they did purchase, what the frequency of their purchasing was both on and off season, what their annual expenditures were for purchasing produce, and how much of that fresh produce was actually sourced through Virginia. And then we also looked at what were their priorities within their organizations, as well as some of the barriers to sourcing locally. And then, of course, we had a lot of questions related to food safety. This spread from what certifications might be required, how they would actually document or verify compliance with different food safety issues, and then, of course, their suggestions or recommendations as we worked with producers. The online survey was coupled with focus groups, so we had a mixed methods approach to the way that we got our information. Unfortunately, with over 550 people that were targeted for the online survey and focus groups, our response rate was around 10%, and this was especially true within certain sectors like hospitals and colleges and universities. So we felt it was really important to really get a better understanding, especially in those sectors. So we supplemented our data from the survey and the focus groups with literature reviews from other market assessments that had been done throughout the country, and literature that was out there related to journal articles and that sort of thing, as well as then having interviews within those sectors like hospitals, universities, and colleges just to corroborate our data. Because obviously we didn't want to extrapolate our data into Virginia from these other regions, but we felt that there was probably nuggets and similarities that would be present across the country. What did we use our survey data for? First and foremost, we really wanted to be able to offer recommendations to both producers and buyers in terms of how to better align between those two. So what farmers were doing on the farm, what they needed to be doing, and what the requirements within those different marketplace sectors were. We also hope that this would really provide a stronger foundation for our ongoing training and outreach efforts. We were already working in a lot of these areas with a lot of different levels of training, but we really wanted to have a more fine-tuned system of approaching all these different needs. We also wanted to create a lot of resource materials, and so a big part of what we did was create fact sheets, both looking across sectors and then within sectors. We also created infographics that were a little bit simpler and easier to kind of access, as well as a comprehensive project report for the USDA, and then, of course, building information and content for our website and social media outlets. So what did we learn? Well, first and foremost, while we did target specifically food safety perceptions and expectations, consistently, there were other constraints that were related to purchasing. So what we found really quickly was, buyers aren't just looking at food safety as a particular kind of checkbox that they needed spread. They were also looking at a lot of other characteristics that were very important to them. We had those ranked within the assessment, and from the most important to least important. And so things like quality, availability, price of the product, delivery and consistency of that delivery, what the product spread or variety was, as well as the quantity or volume, food safety certifications that growers might need to have, the grower proximity to the marketplace, and then product liability insurance. I will say that this needs to be taken with a grain of salt in terms of this ranking, just because, as I mentioned, we did not have a uniform spread among each of the markets, so I think this does need to be taken with a little bit of grain of salt. But it is important to know that all of those qualities were important to the different buyers. In terms of food safety certifications and liability, obviously it looks lower on this list, but that can be deceiving because when you look at places like public schools, colleges and universities and hospitals, things like food safety certifications and liability were definitely a requirement, and there were many different levels of what types of certifications specifically might be required. And we're going to hear a lot more about that today when we talk about GAP certification and HACCP plans and that sort of thing. When we look at the different markets, if we were to point out one market that was especially challenging, that would be the hospitals. One, we had a really hard time finding information. And also, hospitals really exemplified a super complex system. Just the whole procurement process within hospital systems, if it's especially a larger entity, is very complex. There's a lot of hierarchy of management and administration and different policies. Even finding the right people to talk to isn't always easy. And so that definitely represented an interesting finding for us. So when we looked at other lessons that we learned, whether it was across sectors and sometimes even within sectors, one thing we found consistently was that there wasn't consistency, that food safety requirements really varied greatly. A really good example of this was in the public school systems. In the state of Virginia, for example, if you look at Northern Virginia, they may require GAP certification in order to access that market. But if you looked at more rural locations or even in smaller sized cities within Virginia, they didn't require GAP certification. So again, this exemplifies that one size fits all doesn't apply when you're talking about some of these food safety requirements. The other thing was that there were many different kinds of certifications. So this could have ranged from something like a simple food safety plan that was written but not a true food safety audit. Then you might have the USDA GAP audit, and all the way up to GFSI or Global Food Systems Initiative-based audits. So again, it was all over the playing field. When certifications weren't required, the distributors or middle people like food hubs really became a verifier in a sense of some of those food safety practices. They also really played an important role in overcoming logistical challenges, and this is something I'll talk about shortly, but food hubs and regional food hubs and aggregators really do seem to play an important role, especially when we're looking at some of the institutional type markets. And then again, some of these differences. In other cases, buyers purchasing directly from producers often relied solely on verbal assurances. and their established relationships. So again, this came out pretty clearly with some of the school systems where they had that relationship, although it might be considered a compromised population, they still were able to buy from them because of their relationship that they had with them. Regardless of the market sector, purchasing direct from producer was a priority within Virginia, but there were many logistical hurdles, as I've already mentioned. One key point, again, is this perception that intermediaries like food hubs and aggregators could really streamline that access to local foods. And I think that's something that as we move forward that we really want to look at, because I think that they play a crucial role not only in grower training with food safety issues, but in other quality kinds of issues. Regardless of the market sector, communication of the requirements, expectations, needs, and priorities by buyers to the producers was a key take-home message. So what we found was that there's a huge gap often in whether or not buyers were really expressing what their true needs were. And so there really needs to be a better job done with that. But it doesn't just end with the buyers. Producers also needed to really be clear as to what they could do and what they couldn't do to meet these marketplace criteria. And so that two-way communication and relationship was crucial. I don't have time, but I did want to get more into our data, but I did want to share some resources with you. So one of the big ones, we just launched our website in Virginia, the Virginia Produce Safety website. As you can see from this tree, it really graphically represents kind of our approach to everything we're doing with food safety. The risk-based on-farm food safety principles is really a key structure for us to build upon. Regardless of what the market might be, people really need to understand the risk on the farm. And then we touch many different levels, whether it's direct market, simple food safety plan writing, GAP certification, mentoring or training, and then FSMA, or Food Safety Modernization Act, Produce Safety Rule, and Preventive Controls Rule training. We're doing all that in Virginia, and we're really there to help our growers as much as we can to navigate this. The website also has a blog and calendar of events which details different trainings we have going on, as well as different research projects. And then finally, I'd like to just point to our accessing market resources on the website under the producer link. At the link that's shown here, you can find all the details you want about those market assessments, both within the sectors and across Virginia. There's PDF files of the actual fact sheets that we did, as well as many really good resources that folks can follow up on. And the website, like I said, is very comprehensive with many things to help folks tap into that. So with that, I thank you very much for your time, and hopefully the rest of our discussion will be wonderful today. So thank you.
Thank you, Amber. And Lindsay Gilmour will be presenting now.
Hi, everyone. Amber, that was wonderful. And I really encourage all of you to take a look at the website that Amber has worked on. There's amazing resources there. I have been working in value chain coordination since 2000 with smaller scale family farmers, and have become a kind of accidental food safety expert, because that is what farmers need now with and I've also worked in farm to institution since 2006, and it really is, with the implementation of the Food Safety Modernization Act, it's really ramped up everybody's, both on the buyer and the farmer side, everyone's anxiety and confusion, and there are people out there like Amber and myself and Rohan who are really helping people figure this stuff out. It's not easy, but I should say it's not difficult so much as it's time consuming, and sometimes a little hard to wrap your head around it. So I'm going to do a really quick and dirty GAP certification versus FSMA produce safety rule. We did a two-part webinar with CFN last year or the year before on navigating the food safety marketplace landscape, I should say. So if you want to go a little bit deeper into what it means to be GAP certified and all the different GAPs, the certifying bodies and so forth that Amber referred to, you can reference that. I believe that's included in our resource list. So that does not address FSMA in any detail, but that is something we could do if people are interested in us doing that. So one of the things we do want to know is what else would you like to learn? Where would you like to go deeper? Is anyone interested in a video conference where we can really speak on a specific, more focused topic? What we're doing today and tomorrow is very general and high level. Okay, so let's see. I need to do that. And here we go. Hold on one second. I just need to move my thing over there. All right. So I'm going to go very quickly over good agricultural practices, or GAP, or GAPs. Sometimes it goes either GAP or GAPS. Very quickly GAP certification, very quickly FSMA produce safety rule, and then I have a table on the difference between the two. Uh-oh, what's going on? So good agricultural practices, one second, I'm sorry, I just want to minimize that. Very simply, farming and food handling principles, methods, and techniques that reduce risks of food contamination. In the food safety world, you never say you totally prevent risks, because it's not, I mean, all of the things that could contaminate our food exist with us at all times, particularly bacteria, so it's really hard to just eradicate them altogether. So what are good agricultural practices? First and foremost, it's about being proactive rather than reactive. You want to identify problems, assess them, and then reduce the risks of various different hazards. And the whole idea is to maximize prevention so you can minimize having to correct problems after they've occurred. And the main thing that GAPs reduce the risk from are these pathogens. Most particularly bacteria. They are by far the largest source of contamination in foods, and then less common viruses and even less common parasites, although that does occur. And I think some of you probably remember that, what was the name? Chipotle had a norovirus issue that was probably the most recent issue in a restaurant. And then also GAPs address physical and chemical hazards, so different kinds of fuel, even things like WD-40 in your hanging around near your product, your processing line, glass, metal, hard plastic, that kind of thing. And then it addresses the sources of the contamination on the farm, all the various ways that these contaminations, these contaminants can get into the food supply. And then there's really a lot about risk assessment. How do things actually end up on a product? And where is it more likely to happen? And how is it more likely to happen? So good agricultural practices roughly address best practices for training workers. What is the best use of your land? What are the best production or cultural practices when you're growing? How to monitor and deter wildlife, livestock, domesticated animals. Sometimes the domesticated animals can be the trickiest thing. Assessing your risk from your water sources, what's the best use of that water, and then testing the water for generic E. coli is the general test that we use. Soil amendments and chemical storage and use, and then post-harvest handling and sanitation. So all of these things, the GAPs will help you understand how to assess the risks and then how to reduce those risks. So what is the difference between GAP certification and the Food Safety Modernization Act Produce Safety Rule? So first of all, with GAP certification, a third-party auditor will come to your farm. You will have to have a food safety plan. You will have records that show that you're monitoring your practices on the farm. And they will also be interviewing you and looking at how you operate your farm to see if you comply with specific food safety standards. And those food safety standards are based on the GAP principles. So food safety standards, there are a number of different standards out there, but they all pretty much are based on these GAP principles, some of them more stringent than others. And then the key here is that GAP certification may be required by a buyer, but it is not the law. So it's up to you whether you want to be GAP certified if you want to do business with that buyer. And this GAP certification exists to a large extent. The actual certification exists as reassurance for wholesale buyers. As Amber mentioned earlier, there are still some buyers that are more interested in having a relationship with their vendors, and that is sufficient for them. They've been to the farm, they've been to the plant, they see, well, a plant is different, I shouldn't go there. So they've been to the farm and they have a good relationship with the farmer, and they still trust them, but less and less is that sufficient, and GAP certification is more and more required by wholesale buyers and distributors. The Food Safety Modernization Act, these are new FDA regulations for food production. The regulation that applies most to produce farmers is the Produce Safety Rule. Rohan may talk a little bit about where the Preventative Controls Rule comes into play with farmers, but I'm just going to be talking about the Produce Safety Rule. And this is also based on GAP principles. So this is where GAP certification and the Produce Safety Rule, one of the main things they have in common is that they're both based on GAP principles. And unlike GAP certification, FSMA is the law, and if you are covered, you have to comply. And this really came about reassurance for consumers concerned about their loved ones getting sick or dying. And this, you can see down in the right-hand corner, the Stop Foodborne Illness. This is an organization that exists as a lobbying to push for stronger food safety laws. So GAP certification, doesn't matter what you grow, it doesn't matter what size operation you have, it doesn't matter what your general markets are or how much you sell. If you want to sell to a customer who wants you to be GAP certified, then you have to comply. Compliance with the FSMA Produce Safety Rule is rather more complicated, and I'm going to whiz pretty quickly through some of these terms. Again, I'm not going to go deeply into whether or not you have to comply with the FSMA Produce Safety Rule. If you want us to do that, we will certainly do that. There are other webinars online that you can find that help you go through this deeply, but I don't have enough time today, unfortunately, to do that. But very quickly, covered produce, any food that is typically eaten raw. And then you can be excluded if the only produce, if you only grow produce that is rarely consumed raw. And these are literally the 34 items that are listed as rarely consumed raw. If the products that you produce go through what's considered a kill step, you may be fully exempt, although there is still some documentation required. If you go back and look at the table that I showed just before, you will see that food is in there. And so I wanted to make sure you knew what FDA meant by food. It's part of the qualified exemption. It basically means anything used for food or drink for people or animals. And there's another term called direct qualified end user. This is basically direct to consumers, to restaurants, to caterers, to retailers, even direct to a hospital kitchen will be considered qualified end user. And then the FDA uses the term other buyer. So this would be what I would call intermediated markets. That's distributors, possibly food hubs, a retail distribution center as opposed to the back door of a store, and a processor who is processing without a kill step. So someone who perhaps is just doing fresh cut. One of the things that you have to understand is there are baseline values for calculating whether or not you're covered by the Produce Safety Rule, but these are to be adjusted for inflation, and I've included a link here to the FDA page that helps you understand what those baselines are now. So I've circled in red on the right that it was $500,000 in 2011, and it's now $532,645. You can see this gets a little complicated. And then the key with the FSMA Produce Safety Rule is no one is exempt if they are shown to have made people sick by putting adulterated food into commerce. So even if you are only growing food that's really consumed raw, or if you're only growing food that you're consuming, if you're growing less than $25,000 worth of food on average, if you make someone sick, you can still be prosecuted. Here are the produce safety rule compliance dates. Some of you may have heard about the extended compliance dates for the water testing compliance. That is still up for review, and I've surrounded in red the new dates for compliance for the water regulations. However, the rest of the regulation, depending on the size of your business, you may already have to be in compliance. And then there is this thing called enforcement discretion policy. Rohan, I don't know if you're going to be addressing this, but very roughly, it does apply to some operations that previously were required to comply with preventative controls. I've put a link in there so you can go to the website and see if you fit under one of those. It's a little bit unclear for some operations. It mainly addresses operations that are aggregating products from other farms. And then finally, here is a table that I created to show the difference between FSMA and GAP certification. So just run through this really quickly. The GAP certification, again, it's industry driven, it's a business decision for the farmer. The produce safety rule is required by law if you're covered. GAP certification, no matter how much or what you grow or who you sell to, if your customer demands it, you must do it. Whereas FSMA depends on what you produce, how much you sell, and who you sell to. GAP certification requires a manager to have training. That there's no specific training they have to go to. They're going to base their assessment of the manager's training on whether or not you pass an audit. However, there are a lot of GAP trainings out there, and people like Amber, myself, who will train you in that kind of thing. But the FSMA rule requires you to attend the approved FDA training. The only one right now is the PSA grower training. They have similar requirements, same requirements really for worker training. The requirements for raw manure and composting are not yet specific under FSMA. Some GAP standards are very specific. The USDA is following the FSMA standard. So right now it's just recommended that you follow the organic standard. And then there are similar requirements for sanitation. However, certain GAP certifications may be much more stringent. GAP certification requires water testing and compliance with regulations. And then FSMA is very complex right now, so this is all under review. And as I said, you have a longer period of, an extended period to comply with this while they figure out what they're actually going to require. GAP certification is biological, chemical, and physical hazards. The produce safety rule, or FSMA, is just biological hazards. The GAP certification, you need to have a food safety plan, policies, standard operating procedures, and a fair number of records. Some of the more stringent certifications may require things like food defense and food fraud programs, particularly if they are Global Food Safety Initiative benchmark. The USDA has just come out with a new harmonized GAP Plus program that includes these things. And then FSMA requires GAPs to reduce biological hazards, but it basically just recommends food safety policies and standard operating procedures. They're not necessarily, some of these things are not required, they just recommend them. As I said, the GAP certification record keeping is more rigorous. There are more records that you will need to keep than you would with the produce safety rule. GAP certification requires a food safety plan. The produce safety rule recommends it but doesn't require it. For training, organizations like Amber's will provide mock audits and on-farm training. I also do on-farm training. There are other folks around in Maryland. There's a Justine Ballou who can provide on-farm training with University of Maryland. These things vary in cost and availability. Sometimes I'm generally paid by another entity to help farmers. There are other independent consultants out there that you have to pay to come to your farm. And then with FSMA, they will be starting on-farm readiness reviews this year, and you can request one of those. The GAP certification requires a third-party audit, and the farmer has to pay for that, although a lot of state departments of ag have cost-sharing programs. Right now, we don't know the schedule or the cost for FDA produce safety rule inspections. They will be starting in 2019, and we'll learn more about that. And then the key thing here is that GAP certification does take care of most of your produce safety rule requirements except for the required training. The produce safety rule does not replace GAP certification. So generally speaking, if a buyer wants you to be certified, being compliant with the produce safety rule will not do that for you. And then finally, I work with Chesapeake Harvest in the Mid-Atlantic, and I do a lot of one-on-one coaching with farmers to help them develop their harmonized GAP plan. I specialize in doing the USDA harmonized GAP plan, although I have worked with Canada GAP also. And we work with people to get through, right up through their first external audit with their State Department of Agriculture. With the Pennsylvania Farmers Union, I am a lead trainer for them for the PSA grower trainings, and we'll be putting on more of those this year. I think we have one coming up in South Central PA in April, I think, April or May. We're going to be doing on-farm risk assessments this summer and actually creating some videos on specific things that are part of the grower training modules. And I will be doing some preventative controls and HACCP assistance for farmers through the Pennsylvania Farmers Union. And then I also have a background in group GAP and helping people figure out whether they should do group GAP or this other program that I developed, a single entity group certification, and I help groups figure out whether or not either of those programs are going to fit for them. And I think that's it. I'm done. Again, quick and dirty.
Thank you, Lindsay. And as Rohan is getting ready, I'll just remind folks that if you have some questions for the panelists during our Q&A time, we will get to those. So look for your Q&A option and type them in there. And we'll let Rohan get started whenever he's ready. Thank you, Lindsay.
Well, thank you, Lindsay and Kristen. Good morning, everyone. My name is Rohan Tikekar, and I'm going to be talking about hazard analysis and risk-based preventive controls for human foods, which is also known as HARP-C or Preventive Control Rule. Both Lindsay and Amber have talked about Produce Safety Rule, which is one of the 7 regulations within the FSMA, and HARP-C or PC is one of the other regulations that I will be talking about. So this is a risk-based preventive controls regulation. What that means is you might have a lot of hazards within your facility or even your farm, depending on what kind of operations you have. And the intent of this regulation is to reduce these risks before they become a public problem, before they become an outbreak or a recall. It is meant to be preventive and not reactive. What that means is you are required to have systems in place that will address this issue beforehand. One of the simplest ways to look at this is a pilot checklist. They usually have a set checklist for taxiing and takeoff. And it started out with the intent that any potential deviation in your process could get addressed before it becomes a major problem. And I guess sort of similar here, and it is similar even in HACCP. Some of you might have done HACCP, and it's the similar idea that you first investigate your operation or facility in trying to understand what kind of biological, chemical, or physical hazards exist in your operation. It might be that you have E. coli as a potential biological contaminant. It may be that you have a bunch of allergens in your facility. You are processing nuts of different kinds. Is that a problem? Or you might have physical hazards such as metal shavings, rocks, pebbles, extraneous matter, and things like that. And once you have that understanding that these are the potential hazards in your facility, you may be able to develop practices that can reduce those hazards. And that's kind of the central philosophy behind this regulation. it does work in conjunction with other programs like good manufacturing practices. So there is a lot of distinction between what is a good manufacturing practice and when you have to elevate something to a critical control point. And we don't have that much time to go about it, but together with good manufacturing practices, you may be able to address those hazards, the biological, physical, as well as chemical hazards. So this slide sort of gives you the philosophy in a more step-by-step manner. It talks about you first conducting a hazard analysis, and then based on that, you assign preventive controls. What that means essentially is which of the processing steps or which of the handling steps within your facility are able to address these problems. If you are, let's say, a dairy operation, then pasteurization would be one of your preventive controls that addresses the biological risk in your facility. Let's say you are an on-farm processor who are also making ready-to-eat salads with a bunch of various nuts added to it, maybe walnut, maybe cashew, something like that. Now you clearly have an allergen issue. Now, how would you make sure that you don't have allergenic cross-contamination between the different salad products that you're making? And it is interesting because half of our problems, food industry, within the entire food industry, half of our problems are related to allergen recall and followed by that biological hazards. So we clearly seem to be having trouble keeping control over our allergen-related problems. So especially if you have multiple allergens coming into your facility and each of the products have certain unique allergens, that might be something you want to look at. Or you could have sanitation problem. It may be that you have a lot of environmental pathogens such as Listeria or Salmonella within your facility. And how do you take care of this problem by having appropriate sanitation operating procedures? How do you make sure that they are recorded? How do you make sure they're monitored? So again, not each and every operation will be critical from the standpoint of food safety, but some of them will be. And you want to be sure that those operations which do address these hazards are actually being implemented and actually being implemented effectively. So in the subsequent steps, that's what you do. You assign, let's say you parameters and values. Let's say you are doing pasteurization. What should be those pasteurization conditions? If you are doing sanitation of your food contact surfaces, how should that sanitation be performed? At what frequency? Who is doing that? And things of that nature. So again, you are assigning certain parameters and values to each of those critical operations. And then you'll make sure that they are being monitored. They're being done as you say they need to be done. And if something goes wrong, what would you do? What would be a corrective action when somebody failed to sanitize a food contact surface, or you had a potential issue of allergen cross contact, or you had an issue where the product wasn't processed at all? So what would you do if those were the situations? And accordingly, you will have your records as well as verification activities. So I know some of you talked about, some of you wanted to know a little bit about the distinction between HACCP and a food safety plan, which is a requirement in the FSMA's PC regulation. So this slide sort of summarizes all of this. If you already have HACCP in place, you may be able to tweak your HACCP plan to make it into a food safety plan as required by the FSMA regulation. So as you can see, in preventive controls, for example, HACCP plan has CCPs for processes. So your pasteurization, blanching, pH control, chlorine monitoring, those would be your CCPs. In food safety plan, you have those as process CCPs, but you also have other control points that are not CCPs. And those are typically the steps that you take to deduce allergen cross-contamination issues as well as sanitation issues. So same goes with parameters and values. You typically set critical limits for processes, but for allergen and sanitation, you would have parameters and not necessarily values. So basically this list kind of continues, and I don't want to go on to each and every point, but a lot of the philosophy in food safety plan is directly coming from HACCP. The distinction here is you are also expected to pay closer attention to the sanitation related issues as well as allergen cross contact issues. I would say that is kind of the distinction between the two. If you are a HACCP regulated facility, if you are just making juice, if you are making seafood, if you fall under seafood, and if you fall under poultry HACCP, if you are exclusively making those HACCP regulated products, you are not required to comply with entirety of the regulation. But if you have a mix of products in your facility, some of them might be under the Food Safety Modernization Act, and then you will have to follow regulations accordingly. Does it apply to you? This is the question that we get a lot, and this is the question which is by far the most complicated to answer because we have a lot of diversity in operations, particularly in on-farm operations, where we are growing produce, but we are also processing it into various food products of various levels of risk. So it is very difficult to tell whether the rule applies to you in its entirety. But what is still a good rule of thumb is you are required to follow good manufacturing practices regardless of your scale of operation. That means that whatever small scale you are operating at, you can still at your level take practices or follow practices that would reduce the risk of biological contamination, that would reduce the risk of allergen cross-contamination, and would address sanitation issues. Going beyond, and again, this is not meant to be an exhaustive discussion on GMPs. We typically talk about GMPs for a couple of hours, but we don't have that much time. But you can take a look at it in the regulation itself. There are quite a few good guidance available on how to follow good manufacturing practices. Generally, the facilities that are required to register with FDA fall under this regulation. So if you are one of those facilities that is already inspected by FDA, chances are that you are probably going to fall under this regulation as well. Certain exemptions do exist for farm-related activities, and the list is pretty extensive. Particularly if you are making very low-risk product. Let's say you are making jams and jellies of high-acid foods, which is like strawberries, which are relatively low-risk products. You may be exempt from some of the requirements of the regulation. But if you are making a slightly higher-risk product, such as ready-to-eat salad, or let's say you are making a salad dressing, that can be considered high risk, and in that case you might have to follow the regulation. Like I said before, it's very difficult to tell whether it directly applies to you, but the video that I have put the link for, it actually comes from Penn State Extension, and my colleague Dr. Luc Laborde, he has developed this pretty extensive flowchart, so to speak, to figure out whether the rule applies to you or not. I'm going to share these slides with the group, and if you want, that might be a good resource. Now, you might be exempt, but still the supply chain might require to follow certain procedures consistent with FSMA, and this is what we notice very often. Both Amber and Lindsay talked about it, that it's sometimes the buyers that control what safety practices you would want to have in place. And we have had several participants in our trainings where they wanted to, even though they were small, they wanted to be aware of this regulation and how to apply it in their small operation, just so that they can open up new markets and new opportunities. So whether the rule applies to you or not, some of the central philosophy you still want to implement within your facility. So one of the requirements of the regulations is that you develop a food safety plan and demonstrate that you are implementing that food safety plan. So like I said before, the steps are, first you identify what might be the hazards that are in your facility or that are present in your operation. What biological, chemical, radiological, or physical hazards exist. Biological are typically bacterial or virus related, and again, that can be very product specific. Chemical would involve allergens, it would involve pesticide residues, heavy metal contamination, and those sort of issues. Radiological is plausible presence of trace radiological material. Again, it is very facility specific, so we cannot generalize it for all the facilities, and physical hazards such as metals. Now, then you determine whether these hazards are risk within your facility. Again, each operation is different, each supply chain is different, and it might not be a risk within your facility. In that case, you don't need to have a preventive control. If it is a risk in your facility, what are the controls in your facility that reduce this risk? And like I said before, this could be pasteurization operation, this could be pH adjustment, this could be water activity adjustment, this could be sanitation, it could be as simple as using 2 different vessels for cooking 2 different products that contain allergen. So again, that could be elevated to the level of controls just to reduce your hazards. And then you make sure that those controls are being applied, that's being monitored. And what would you do if those controls fail? So that's kind of the central idea, which regardless of your scale of operation, you may be able to implement within your facility. So the next question I presume everybody would have is, how do I go about this? What's the starting point? So like I said before, we have been doing a lot of these trainings related to the regulation. According to the regulation, you are required to have a food safety plan. And to create a food safety plan, there needs to be at least 1 preventive controls qualified individual within your team. And one way to become a PCQI is to attend a 2.5-day training curriculum that is organized by FSPCA. It's Food Safety Preventive Controls Alliance, which is IIT Chicago and FDA's collaborative effort. And they have these standardized curriculum which are rolled out worldwide, and various university extension facilities as well as private consultants are offering this course. So that could be a starting point to learn more about this regulation and how you can use the practices that are recommended in this regulation within your facility. We have been doing this training for the past 2 years. We have trained over 100 small and medium scale growers and processors who think the rule applies to them. We received a small grant to do this training, which was very helpful to the stakeholders. So if you are interested in this regulation and if you want to attend one of those training hosted by us, you can reach out to me. My email address is given here. It's rtikekar@umd.edu. But clearly, as I just saw through the list, I think you are the range of audience is pretty global here. We have audience from all over the country as well as Canada. So one of the best ways might be to reach out to your extension agents within your state, and they might know how to go about this. And with that, I think I've kind of tried to give an overview of this regulation, and I would be happy to answer any questions you might have.
Thank you, Rohan. And again, if folks have questions, go ahead and put them in the Q&A box, and we'll try to get to them during the Q&A session. But first, we want to have Becky Howe from Weaver Orchards. She's their food safety director, respond to some of the issues that have come up and how they are able to handle them on their orchard. So thank you, Becky.
Good afternoon. I am Becky Howe. I am the Food Safety Director at Weaver's Orchard. We are located in Morgantown, Pennsylvania. Our orchard was founded in 1932, and we are on the 4th generation. So the current owner is Ed Weaver, and his son Justin is our production manager. So father and son work very closely on the farm together. We offer pick your own to our customers. We also do some agritainment. We do fall festivals in the fall time with hay rides, pick your own apples and pumpkins. We offer games and festival fair food. We also offer read and pick story time throughout the pick your own season during the summer. the children. It's mostly geared towards preschool up till about age 10 to 10 or so. They come in, listen to a story, and then go on and out and pick a fruit that the story was based upon, such as blueberries, raspberries, whatever's in season at that time. And our newest program that we offer is our Orchard Explorer Day Camp, which is more geared to 12-year-olds, maybe to 14-year-olds. They come and spend an entire day here on the farm learning about food safety. They also learn about pollination, water systems. They learn about irrigation and those types of things. Food safety programs that we have for the orchard are harmonized GAP and HACCP for our apple cider making. And the harmonized GAP program was required by one of our buyers. Up until August of 2016, we were not required, and then this buyer requested the GAP audit. That's where I came in. I was hired in September of 2015 to directly kind of oversee the food safety programs, ensure that we have our food safety plan written, that we have our HACCP plan stays up to date, and all documentation and training is done appropriately for GAP and now also for FSMA. Coming here in the future, we have just discussed about the retail side of the business, our deli, our bakery, those types of areas where we can also institute food safety plans, and I'll be writing food safety plans for each of our areas and ensuring that they're doing proper sanitation, wearing hairnets or hats, those types of things. We're audited approximately once per year. We can always be surprise audited. The retail market and HACCP is usually audited once a year by PDA, Pennsylvania Department of Agriculture. They were actually just here about 3 weeks ago, and we had a very good audit and result. And we're also GAP audited once per year with the option of having them come in at any other time. The GAP audit usually takes place about August. They want to see us harvesting, and so as we broaden out into what we're offering through our GAP audit to, say, strawberries, blueberries, those types of things, they may come several times throughout the year to observe us picking and packing and harvesting, washing if need be, those specific fruits. And our GAP audit costs approximately $550 a year. That does not include any upgrades or improvements that we need to do on farm. That is just for the audit. Most of my job training, Lindsay had asked me to speak on this, has been self-taught. I've gone to a couple training seminars. I was at a 2-day training seminar on how to write our food safety plan, 1-day FSMA training through the Produce Safety Alliance. But most of my time is spent researching rules and regulations, ensuring that we are following them as accurately as possible. So Lindsay has been a very big help in learning food safety plans and the rules and regulations and laws. Also, Jeff Stoltzfus has been really helpful as well. Probably, depending on the time of the season, the time of the year, I spend about 30% of my time in winter doing food safety type things. As we ramp up and start getting into planting of trees and those types of things around this time of year, I could, by August, September, get into about 60% of my time being covered in food safety. When we do include retail market on everything, I could definitely see almost 80 to 90% of my time being spent on food safety. We are currently audited by EquiSearch for our GAP. We are looking to switch over to USDA because of the new GAP Plus audit that they have, and including the GFSI standards. It's just a little bit of a higher standard. Some of our buyers do sell to schools and hospitals, and we just feel that having this higher standard with the GFSI may be beneficial to us in growing our marketability. So at this time, I'd be happy to answer any questions. Just post them in the Q&A, and we're going to put up a second poll for you all to answer. And I look forward to being able to help anybody in any way possible. Thank you so much. Have a great day.
Thank you, Becky. And if all the panelists can turn their video back on, we do have some questions from our participants. So first, if participants can quickly answer this poll, that would be helpful. And then we can see the results when everyone has placed their vote. Let's see here. Okay, so how much do you need to know about food safety in your daily work? And you can see the results there. All right, let's get to got some good questions that came in, so let me pull those up. Okay. All right. Okay, question for Amber. First, if you can just repeat where folks can find the survey that you conducted and the findings. And then also there's a question, a participant is interested to know if the Virginia study looked at all average cost to farmers for upgrades needed to come into compliance for GAP or FSMA. If not, have other assessments considered this?
Okay, as far as the locations where they can find the assessment, if they go to the website, everyone will be getting a PDF of all the talks from today. So on that next to the final slide, I actually have the link to that where you can go directly, and when you access that page, then it'll take you into the Accessing Markets work. As far as we did not look at that because we were really interested not so much what it costs for audits as much as what buyers were requiring for their food safety. So I'm not aware of other assessments that have been done in Virginia in particular related to that. I can tell you, like in terms of GAP certification though, in Virginia, we do work with Extension with folks directly. I do a lot of mentoring on the farm with local agents in those communities, and on average I'd say at the new USDA rate, those are the audits that we tend to work with. They're $108 per hour for the auditor to come, and so it averages about the same as what Becky said, probably between $500 and $650 for the actual audit. It's just going to depend on what that farm, how complex they are. In some cases, they're just getting a field harvest plan done or a farm review. They're not getting like a harmonized GAP where it might be a lot more comprehensive in terms of packing house. So that could be up to $1,000, if not more, depending. We do, through Extension in Virginia, offer templates for growers. So while every farm is different, we do work very individually with folks, but we do offer that as a service, including the whole written plan, as well as we offer the services for free pretty much. That's a big part of what my role is in Extension. So, and then I think there was a question about the produce safety rule, I think was on that too. If folks would need to comply with that, we are part of the National Association of State Departments of Ag and our Department of Agriculture in Virginia received a grant, which I'm sure like many of our folks that are on this call probably is the case for them as well. And so we've been able to offer the produce safety rule training for as little as $30 if somebody is a grower and they're covered. That's not going to be forever because we're running out of that grant, but it's been helpful to folks to get that. So.
Thank you, Amber. And I'll also mention that the PowerPoint and recording for this webinar will be sent out to registrants. And we also compiled resources. Some of them are specific to states in the Mid-Atlantic region. Those resources are actually already available on the CFN webpage for this webinar, but we will also send out the list of resources so that you can look into some of these things that Amber and others have mentioned during the webinar. Another question, maybe this would be a good one for Lindsay. What advice would you offer a new farmer who's just starting out, even if no specific food safety practices have yet to be followed? Any best low-cost food safety practices that are easy to implement? Do you want to try that, Lindsay?
That's a good question. There's a noisy group next door to me, so hopefully this won't affect audio. Actually, I think the most useful thing you can do right now and the most available thing is the PSA grower training. If you go to that, it doesn't mean that the FDA is going to show up on your doorstep. It is really a basic GAPS training, and right now they're subsidized in your state typically. Amber, do you know how much the trainings are in your state? Unmute.
We are charging, if a grower wasn't covered, it would probably be like 125 to 130. If they're covered, or if they are covered and we're through the Department of Ag, we're charging $30 or so, and that's strictly for the lunch. So
right, yeah. So right now there's a lot of funding to subsidize the PSA grower trainings in the different states in the Mid-Atlantic and all over the country, really. So it is a good time to take that training and get basic GAPS training. The main thing you could be doing to get started is getting yourself trained. If you're just getting started, you probably don't have a whole lot of workers, but if you do have workers or volunteers, you want to make sure they're getting health and hygiene training. You want to start to understand how to assess risks in your operation. The PSA grower training does go through that and helps you to understand what risks you should be looking at. And get hold of your co-op extension. Typically in most states, I don't know where this person is, but in most states they will be offering at the very least the PSA grower trainings, and oftentimes, as with Amber, one-on-one assistance for farmers. And if you're in the area that I'm in, I may be able to help you if you're in the Mid-Atlantic.
Thank you. And I see that Sonia just put in the chat box the link to the webinar page where there's a link to the resources. I tried to pull together, information that would be very relevant to folks. So I would take a look at that resource list, and I think that'll answer some of the questions that we were not able to get to today.
And actually, Kristen, the second webinar that we did of our 2 webinar series really got into where do you start, what are the steps you take when you first begin to get into food safety on your farm. Right.
Yep. And that's listed under the resources on that webpage that Sonia has in the chat box.
CFN Navigating the Food Safety Landscape.
Great. Well, I want to say a thank you to all of our resource experts. It was extremely valuable to have you on this webinar. Thank you so much for all of your preparation and all of your time and offering all of your wisdom. And if we can go to the next steps slide. Here are some next steps and strategies for you to continue to engage and dig in deeper around these topics. The Chesapeake Farm Institution Work Group and COG's Local Food Distribution Work Group are planning additional events this spring, summer, and fall. You can also see how to sign up there for the CFN's newsletter. And also just a reminder that we have part 2 of this topic tomorrow at the same time. It's understanding wholesale buyer expectations, digging deeper on food safety certification, quality, post-harvest handling, and packaging. And I would encourage you to register for it even if the timing doesn't work, because that way you can still receive the recording and then listen to it at your convenience. Okay, and last slide. All right, well, again, thank you all so much. And please check out ChesapeakeFoodshed.net for more details. And thank you again to our resource expert presenters and to both the Metropolitan Washington Council of Governments and the Chesapeake Farm Institution Work Group. Have a good rest of the day. Bye-bye.